Hello, everybody. Good afternoon. Thank you for tuning in for an update. I think we'll go over some data, touch on a couple points and bullets, and then just take a couple questions. Unfortunately, we have lost another neighbor. She was in her 80s. She was of another race. That means not Caucasian or African American. She did have underlying medical conditions. We now have 30 individuals that have passed to this virus. And so certainly our thoughts and prayers are with her and her family as they grieve in these unprecedented times. Current cases, we started our proactive testing. We knew there would be more cases. We're finding them. We have 876 cases. That's up from 841 yesterday, 35 new cases. We'll get into what those cases are in a minute. Hospitalizations, we have 39 individuals that are in the hospital. It's up 2 from yesterday. This is 13% of our active cases. So the percentage of our active cases, it's been going down. Our hospitalization numbers have been going down, even though we went up a couple today. The trend has been a good downward trend. We have 8 individuals that are still in critical condition. That number is the same as yesterday. We want to think about these folks, pray for them. They're in a big fight right now. We need them to get better. Overall, we've had 111 people who have gone into the hospital and been released from the hospital. So to give an idea of people, a lot of people have gotten better in this process who've gone into the hospital. A breakdown on some demographic information on those who are in the hospital. 22 are Caucasian, 8 African Americans, 2 another race, and 7 folks who've declined to share their information. Today we have 550 people who have recovered, 7 new recoveries, so that's good. That's our green curve. So remember, we're watching our red curve. That curve essentially doesn't ever end because anytime there's a new COVID case in the community, it's going to be a new case. Our green curve is recoveries, and the curve that matters to us is the yellow curve. The yellow curve is folks who are still either in isolation, who still have not recovered yet from COVID, and that's a reflection on our ability to fight the virus in real time. So our yellow curve went up quite a bit from yesterday, 27 cases. We anticipate, just looking at our trends in our department, we're going to have quite a few recoveries over the next few days. So the yellow curve's been fluctuating down one day, up the other, back and forth, specifically because of our proactive testing that we've done, finding many individuals who had mild symptoms, finding individuals that had no symptoms that probably never would have been tested if we did not find them. Right now, we've had 111 individuals who have been household contacts out of the 876. So really, you're talking about 765 individual cases. They then have a contact with somebody in their household. We knew that would be the case. So 111 people are contacts. Why does this matter? It matters because we knew that if someone gets positive in a household, they have a roommate, they live with somebody, spouse, child, that there's a high probability that that will spread. If you have somebody who's positive, they go into isolation. The people who live with them go into a quarantine. So this is not new work for our department, and from a tracing standpoint, there's not a lot of new work to trace. So the risk to the community from these contact cases is much smaller than a regular community spread case. 23 of the 35 cases are related to senior living facilities. So that's something that we've seen. 65% of our active cases are now essentially affiliated cases related to senior facilities or contacts. That is important that when you can break down this data, because what we are always trying to monitor is what is the risk to the community through community spread. are we making progress related to community spread? 12 cases were related to community, as many lives as we can in this process. So right now we have 943 people in isolation or quarantine. I believe this number is actually pretty stable compared to yesterday. Again, as we have more recoveries. China, 43 total cases, 31 recoveries, 12 active cases. Town of Camillus, 33 total cases, 28 recoveries, 5 active cases. Town of Cicero, 29 total cases, 25 recoveries, 4 active cases. Town of Geddes, 28 total cases, 18 recoveries, 10 active cases. Town of Lysander, 28 total cases, 18 recoveries, 10 active cases. Town of Pompey, 21 total cases, 19 recoveries, 2 active cases. Town of Skaneateles, 15 total cases, 12 recoveries, 3 active cases. Town of Van Buren, 6 total cases, 2 recoveries, 4 active cases. Town of Marcellus, 4 cases, 4 recoveries. Town of Atisco, 4 cases, 4 recoveries. Town of Lafayette, 3 total cases, 2 recoveries. Even I can do that math. 3 minus 2 is 1 active case. Town of Elbridge, 2 total cases and 2 recoveries. Fabius, 2 total cases and 2 recoveries. Spafford, 2 total cases and 2 recoveries. And Tully, 2 total cases and 2 recoveries. That's our Onondaga County demographic data. If you look at this chart here again, this shows you our regional, essentially our regional chart. You see the red curve, you see the green curve going in the right direction. You see a flat yellow curve. That's important. This isn't just about Onondaga County in central New York. It's about all of the counties next to us. When we prepare for a potential restart, we need to be, we're so connected. Many of our employees live in the other counties. Many of them come in and work in Onondaga County who live in Cayuga and Oswego and Madison and Cortland. So you need to be able to see really that yellow line flatten out. It has. The green line going north, it is. So very positive numbers overall for our region when considering a restart. Testing, we have more and more testing sites potentially coming on board with the governor's announcement with their plan to work with pharmacies potentially for more testing down the road. We'll see what that looks like. Receiving negative tests on a daily basis is a challenge. We talked about that yesterday. We're working on getting our arms around that, but what we can say is we get the positive tests every day. That's in real time. We're the first to know as we get it through the state and through the other labs. And we have pending tests. We had 2 very busy days related to proactive tests in assisted living facilities. So not necessarily the hot spots, but really good proactive testing. We have over 400 that have been done in proactive tests, about 550 total pending. We got over between 100 and 150 pending tests related to our hospitals and our triage testing site. So we're seeing, again, demand related to CDC recommended symptoms-based testing down, which should mean that your community spread cases continue to be in this new range that we're in now. But our proactive testing is either picking up asymptomatic folks, which is important because they still can get other people infected. Folks who have mild symptoms, probably not enough to go merit a test, we're finding. And certainly we know that the state of New York has been doing testing in nursing homes as well. Looking at some of the social distancing, look at our report on this. There's always going to be cases where it's not perfect, but overall our community has responded well. And we want to continue to encourage people to do this. This is the new norm. When businesses start to reopen, there's going to be expectations, just like if you go to a restaurant for takeout now, that you're 6 feet apart. And certainly, I know some people are frustrated about having to wear a mask. I got a lot of emails about the fact that we have masks for people, questioning if we're infringing on their rights. No, we're just providing masks, and we just think it's a good idea in this time to wear one. And certainly many other doctors agree with us, and the governor has an executive order about it. So this is going to be part of what we're dealing with until this virus has a cure or there's a treatment for it. This is not like the flu. The flu, you get a flu shot. There's different ways to treat. That doesn't mean the flu doesn't lead to illness and lead to death. It does. But right now, what's so dangerous about this is there's no way to really treat it yet with a widespread protocol with the healthcare community. So certainly, what can we do? We can continue to social distance. That's going to mean different things as the economy begins to restart. And we're going to adapt just like we have through this process, and I know we'll adapt well. Related to restart, we continue to work with our state partners as a region, Central New York and the Mohawk Valley. Again, I want to thank all of our other county leaders in the central region with our partners in Cayuga and Cortland and Madison and Oswego. Certainly the mayor of the city of Syracuse is a great partner of ours. I thank Mayor Walsh for that. And certainly County Executive Pacenti in Oneida County with all of our Mohawk Valley partners. We put a lot of work into this process, having some very fruitful conversations with the state of New York now. We were happy to see yesterday some of the governor's thoughts. We knew what some of the issues were that he had concerns with, but he was here in Syracuse yesterday and talked about some other things that we think we're well prepared for. Again, elective surgeries, very happy about this. A lot of people are concerned about restart. Again, part of getting into a restart is loosening up some of the regulations on existing businesses that are still operating. Elective surgeries goes to public health. When people need a surgery because they're sick with something, nobody's getting voluntary surgeries for the most part. When you're sick with something, you need to get fixed. And so by doing this, this really goes to getting furloughed employees back to work, getting other workers who are on the sidelines back to work, getting people who are sick the help they need. We're appreciative of that. And certainly more and more guidance from the state on loosening up these regulations is appropriate as well in certain areas. And also just wanted to touch on, we've talked about it, you've asked me the questions about as we move into restart, which is our ability to fight this virus in real time and still open up businesses. And then eventually we're still fighting this virus and we're talking about economic recovery. But part of this is our budgetary toll. Again, depending on what happens here, right now we have a situation where 52% of our revenue comes from sales tax. We know we're going to have a massive shortfall for this period of time, and as the phase-in gets going, and certainly we're looking at huge numbers. We also know that the state of New York has said if their financial situation doesn't get better, they're going to potentially cut local governments, and that is another variable in this, which is very hard to account for. We have a balanced budget. Our ability to raise revenue at this time doesn't really exist. Our only option, if we are looking at funding cuts or certainly revenue losses, which we know are going to happen, is to cut from within. So just a reminder of what we've already done in county government, really from back in March. We have frozen $25 million worth of austerity spending, hiring freeze. Our 103 line, we've cut back hours on more than half of our 103 workers. Recently, you heard me in the State of the County address. I know everybody listened to that address. It was what a great memory that was. But we talked about a retirement incentive as a way to get people in the workforce an opportunity to retire. Why is that important to this process? We can then hold those positions and save that salary savings. And so the legislature last month approved our retirement incentive, so we'll know what those numbers look like in June. But already on our own side of the ledger, we've essentially already freed up $30 million. So we're not asking for any sort of bailout. We know we're adults, and we've been leading the response on this. But I think the reality is as follows. You cannot to our two governments who are larger than us, it's difficult to tell us that you have to shut down. And both governments, the federal and state governments, did. We agreed with that decision. But you can't say everybody's got to shut down and then we're not going to help you when all your revenue goes away. And then to say everybody's got to shut down, but then we might still cut your revenue we give you every year too, is problematic as well. So certainly we know the federal government is the one who can sell treasury notes, and we know they can help out the states, and we know they need to help out the local governments here. Our deficit isn't because we mismanaged anything or we don't run a good ship. We do. We have one of the best credit ratings out of any county in the state. It's because we got hit by a pandemic. So certainly I want to thank Congressman Katko, Senator Schumer for their leadership and working with us. But we need some federal relief, and certainly the state needs some relief as well. Couple lines here, then I'll take some questions. Upstate Triage Hotline. This is a phone number that you call if you're having symptoms, you want to get tested for COVID, you don't have a doctor, or maybe you get referred in by your doctor. 315-464-3979. They're going to screen you, and if you hit those CDC guidelines, they're going to send you to the triage testing site. Our seniors, our healthcare workers, and adult nutrition hotline. Again, we've provided meals on a regular basis for folks, groceries, toiletries, kind of a stop all for any people who need help. And I want to thank all of our volunteers and county workers who have really been manning this line. It's something that these people would have nobody else to turn to. We weren't doing this before COVID. The phone number is 315-218-1987. We're extending our Child Care Solutions Essential Workers Daycare Plan through May 15th. We've gotten some emails on that. We'll reassess this plan on May 15th. But again, we've been paying, and the state has been, it now looks like they're going to be sending some money in as well with income criteria on it. Ours has no income criteria. If you're an essential worker and you have a daycare issue, you can call 315-446-1220 and your child can get child care. And we've been doing this. Why are we doing this? It's because we need our essential businesses working and making things, really working on our supply chain, working with public safety, working with healthcare. So again, 315-446-1220. Our continuity of care program is certainly one of the reasons why we've been in the situation we are, because we've kept our frontline professionals on the front lines making tremendous progress. And again, we talk about mental health. This is a public health related issue, something certainly becoming more prevalent in our lives. Please contact 211 for social and emotional support. They can help you. They can help with referrals. They can help if someone else in your household is having a challenge and they need help. So please do that. Questions?
Yesterday at the governor's press conference, he talked about a 12-step restart plan. So will our county have to follow that specifically, or will we kind of base off reopening off of that 12-step plan?
Yeah, I saw. So a lot of the points the governor hit, we already had incorporated in our concepts and our discussions. There was some new things that we saw there, but we've already addressed. For example, isolation, housing for essential employees or folks who are worried about quarantining and exposing household contacts. We already do that. So that's in the plan. Other communities might not do that. We're doing it. Tracers, he put a certain number of tracers per county based off of, I believe, population. We're on it. We got our own COVID tracking team that we're putting together. We got tracers now. We're cross-training county employees on more tracing. We don't need 140 tracers today, I can tell you that, with 290 active cases and 65% of those active cases being in certain numbers of buildings. We don't need 140 tracers, but scaling up, it's there. We're on it. A couple other things, testing, proactive testing. We've been doing that. We now have enough people doing tests each day that have capacity each day, that doing 13,000 tests a month won't be an issue. The majority of those tests will be proactive tests, because right now it took us 45 days in the heart of this battle with the virus to get to 13,000 tests total. Certainly the intensity of the virus today is not where it was 4 or 5 weeks ago. And so from the CDC symptomatic guidelines, that will probably be 25, 35% of what the testing we have. But we'll be doing proactive testing throughout the community to meet that mandate. So we learned a little bit about what the governor was thinking. Some of the stuff we're good. Some of it we'll do a little bit more work and roll out as that date gets closer. We'll continue to have conversations with the governor's team about Central New York and the Mohawk Valley, what makes us unique. If you looked at our numbers, his antibody testing numbers, I think we're the lowest in the state. When you look at the Central New York region, our county's always been about 7.8% of our test positive. Central New York region, it went down to 7. That's comparable. I believe we were right next to Arkansas and Tennessee. So when you look at all this, we're in pretty good shape, and there's a lot of reasons why we're where we are, mainly because of the great work from our health department and our first responders. But the restart conversations, one, we're ready for. We put a lot of time into it, and we can meet and address the concerns that the governor has.
This is the third day in a row you've had to announce at least one death from that podium. Can you analyze that at all? Is there a narrative behind what seems to be more regular deaths?
The reality is where the virus is right now. And I touch on this because we hope we're wrong. And first off, every life is so precious. But when you look at all of our new cases, for the most part, 75% of our new cases this week related to senior facilities. Many of these folks already have underlying medical conditions. They're in for a real fight. And why we did what we've been doing related to testing was about finding risks to these populations and containing that risk so that the result isn't more death. And so I think the stark reality that we have is that we're going to lose more neighbors. And that is what we have to prepare ourselves for.
Is the situation at those senior living facilities worse than it was 3 weeks ago, or now you just know that it's there because you're doing proactive testing?
I think for the most part, we're containing it now because we know more. You can beef up and work with the teams, making sure their infectious controls are in place. I think in some of these facilities, certainly, I think the governor talked about nursing homes yesterday, saying it's kind of like setting a fire in a dry field. It just goes through. I think certainly in some facilities, whether these folks have had COVID for a week and we're finding out a week into it now because they got tested or not, I don't have enough information to talk about that, but certainly there's buildings in the county that have a problem. There's other buildings in the county that didn't have a problem, and we found some people that are asymptomatic. So the reality is if we weren't doing what we're doing, there would be more victims of this, and there would be more fatalities of it. What is it? From a standpoint, why we're breaking out the data is because we want to tell the accurate story of where COVID is in our community. And the reality is COVID, for the most part, for 65% of our cases, is very contained. And there's very little risk to the community at large. It's those other 35% of the cases that represent a community spread. And each week, that percentage is getting smaller and smaller.
We've seen this as a bigger problem in New York City, but are there any people dying in their homes in Onondaga County from COVID-19, and are people being tested after they pass away to see if it was COVID-19?
I think, Andrew, To your second question, I believe, I'm not 100% sure, but I believe there has been people tested after related to COVID. Sometimes there's challenges with an individual on figuring out if they had COVID and then they pass, if it was COVID related. Certainly they had COVID, but do you just automatically look at that? There's been one or two cases that have been attributed to COVID that I guess you can make the argument maybe it was something else or you just don't know enough about it. But I believe that people have looked at a case about testing after death if it was COVID related. What was your first question?
People passing away in their homes.
I don't believe that has happened in our county.
Ryan, the proactive look at senior living facilities has been very successful in finding COVID. Are you aware of anywhere else in New York State adopting that same action? And how closely does that mirror what you're hearing from the state about what they're doing in nursing homes?
So I was on a call with where we did a Q&A with NISAC today, and one of my colleagues in Ulster County, County Executive Pat Ryan, he has started to do some proactive testing in similar situations in his county. His county's smaller than ours, about a quarter our size, been impacted very large in a big way. They're in between Albany and essentially the Hudson Valley counties. So it'll be interesting to compare that. What they've done, I don't know if Dutchess has started. I know County Executive Molinaro and I had a conversation about that. And I know in some of these other counties, as we've gotten together and have share these stories, are starting to look at it. In Oneida County, County Executive Pacenti was telling me they've had cases in jails and they've had cases in essentially senior facilities, and the community spread has been, pretty minimal besides that. Or the community spread, if they had more time, they could probably connect it to employees at the jails, and so. I think as this goes on longer, you're learning more and more and best practices from each other. A reminder, your counties are the front lines of this. We're the ones with health departments. We work through and get regulatory guidance from the state health department. But your workers on the ground are your county governments. And so it's very valuable having the relationships you have with all these leaders, and you learn from each other. And we learned early on by watching what was happening to our friends downstate.
Well, just going back to the dry grass analogy, is the state being as aggressive in nursing homes as you are being in senior living facilities?
I believe that the state of New York has been pretty robust the last few weeks when we've been talking with them related to what our plans were, our concerns. And I think part of why the positive numbers are going up is that they're not just my tests being done. I know that they've been doing tests as well.
Onondaga Nation still has no cases reported. So do you guys have a line of communication with the nation, and are you actively doing testing there?
Yeah, so Dr. Gupta has good relationships with some of the leadership on the nation. We have not been on the nation territory doing testing. I don't know if you put these people up to this or not today, but I've received 3 emails on this today. And so here are my theories. One being there's very little travel onto the nation territory. So that limits community spread if you have folks quarantining or staying on the territory. But secondly, if people are getting sick, are they coming to our testing sites? We're communicating with these folks, and we value this relationship. But I couldn't tell you how many people from the nation have gotten tested. That it's very complicated. Onondaga Nation are our friends, they're our neighbors. They're a sovereign country, so they have specific rights.
Rights meaning they haven't come, or you're not aware because there's no way to track that?
Yeah, there's no, when someone shows up, you call the Upstate Triage Hotline, you get screened for really 5 or 6 different things. You show up at the testing site. A question is not, or what country do you live on. We don't even get ethnicity demographics at the testing site. So to do that, it's open to everybody, certainly, and we've communicated that through leadership at the nation, and certainly we want to help our neighbors at the Onondaga Nation, just like we do with all of our other surrounding counties when it comes to giving testing, making that available to their residents.
Because it's a sovereign nation, do they have their own availability of testing? Are
I
they
don't,
doing anything?
I don't know the answer to that.
So is it possible that there could potentially be positive cases there that just aren't reported?
Yeah, I think if you look, so if you looked at it, if you believed the antibody testing that the state did, they gave Central New York, our region, 1.3%, which is the lowest in the state, but 1.3% over 650, 700,000 people, that's a lot of people that aren't showing up, right? So if you believe that, that many people have been positive. Now, I don't know if I necessarily believe 1.3, but I think there's people that we haven't tested that have had it and that have gotten better. And so I think it's safe to assume that there's probably somebody on the Onondaga Nation that's had this, and they may have just gotten better.
Would you go over the proactive testing data you have again? How many total proactive tests were done?
Well, I can give you the pending ones. I don't have the total proactive testing ones. It's well over 1,000. But the pending one with assisted living facilities is almost 425. And so we got more of those facilities scheduled this week, and we'll get through this week. And then we'll certainly, then we have other facilities that have reached out to us about the county about proactive testing. We'll get those in the queue, and then we'll go do that. And we're building this into this program that we want to do with the state anyways. And so we'll continue to do this now that we have the resources to do it.
And is most of this proactive testing still being done at the Walmart testing site?
That's one of the ones. For the most part, the proactive testing now is a team effort with our emergency management, coordinating with Essentia Health, going into these facilities and testing these individuals, and then bringing the test kits to the Syracuse Community Health Center to get processed.
Ryan, why haven't you been able to get test numbers, the total test numbers from Walmart? I thought that was something you worked out with them before you started it.
They are not as responsive as we'd like them to be at times, Tim. So it's not because we don't ask for the information. Sometimes we'll get it, and we'll get a lot of it at once. And certainly we would like to get better collaboration as far as data from our partners at Walmart.
Do you blame Walmart or Quest?
I'm in a different mood today, Andrew. I'm not going to blame anybody today. I've been cranky on some of these days, so maybe later this week I'll start blaming people. I'll just say that I know that they're rolling out this program in a lot of areas. There is probably communities that aren't asking for the data. They're just so desperate to have testing done and to be able to say, go get tested, right? We use this data to make a lot of decisions. So for us, when we don't have all the data, we break out in rashes and we get very anxious. And so I'm not ready to be super mad yet about this situation. I think our friends will get us the information we need. I know we're getting the positives. So the number I like to usually talk about is 7.8% of the tests are positives, or 7%, 7.5%. I can't do that right now because the data would be, I know it's wrong because we don't have all these tests that have been done out there, all the negatives yet. So I'm not going to share information that I know is wrong.
Well, let me not use the word blame. When you pick up the phone to call these organizations, is it a Walmart phone number or a Quest phone number? Who's managing?
It is a Walmart number that I call, yeah.
So you said that it's kind of like a team effort now as far as the testing with the nursing homes and things, but is Walmart still mostly focused on the senior homes?
So Walmart, what we've done, and that I know has happened, is that our nursing home employees have been contacted and directed to go to the Walmart site. So the state of New York then is responsible for testing nursing home residents. We cannot test nursing home residents. And then we have been out testing assisted living facilities, both employees and residents, and then some independent living facilities where we've had cases, employees and residents. And certainly when we have a first responder or a healthcare worker, most healthcare workers can get tested at the hospitals that they work at, but many of them have been able to go to Walmart or Triage testing site, and that's kind of been the program.
What's the traffic like now at the Triage site?
I think we had 60 symptomatic tests in the 60s 2 straight days. So again, that to us, that's a sign that the community spread is we're making progress. When you see 5, 3, 11, 12 out of your community spread cases, that's progress. That when we were at like 17 to 19 going into the week, so on an average. So our 7-day rolling average is going to be lower than last week for community spread. The difference is, and the uptick in the numbers is, we're looking for it in areas that nobody else is looking for it, and that's what the state is essentially requiring us to do moving forward, and we're already doing it.
You may be looking for it, but 296, I'm pretty sure, is the highest number of active cases we've had, right?
No, well, I don't think so. Probably not when we started. So each day is a moment in time.
Right.
So tomorrow, if I have a bunch of recoveries and that number's down 15, 18, right?
That's what you want, but
it won't be the highest.
Peak, correct? So that's where you're going to start when you talk about a restart, or?
Yeah, we've said everybody interprets guidelines different, right? There's some debate yesterday about hospitalizations and when you start electives. Our interpretation was pretty clear that electives get to start. There's debate about that, though. So we've always said we need recoveries going up. There's always going to be new cases until the virus flies away or there's a vaccine and we still have new cases. And it's always been about flattening the yellow curve. So I'm looking at the yellow curve from here, and I don't have 20/20 vision, but it's pretty flat. And it's not just about our county. It's about this as well, because the other counties are so connected. So I think when we talk about flattening the yellow curve, we're there. And I think about understanding the yellow curve is the key to this, because we don't have 290 cases of people that got there because they were out working at this business and they went shopping and they got it. 65% of the cases on the yellow curve are because they live in a building and the virus is infecting the whole building. We've just identified it so we can quarantine any risk to the public, anyone else in that building, and we can get these people the help they need.
How has that argument gone over in your conversations with the state about a restart?
I don't even think it's an argument. I think it's
Perspective.
It's an acknowledgement is the word I'd like to use. It's certainly an acknowledgement. You can't have tell counties, if you go out and do the right thing and you find dormant COVID that's asymptomatic, that could be a risk, that we're going to hold that against you in a restart. Or else you know what everybody does? They don't go test. That's what happens. You can't hold that against us. So you can't hold red curves against people, because we know it's here and it's always going to be here. It's about our ability to function in real time and to isolate it, identify it, and quarantine it. If we're being held to a standard that if you have new cases, even if it's in one building and all of them are coming from one building, you can't reopen, who's going to go test the cases? The risk in these buildings to the rest of the community is minimal. It's minimal. No visitors. The employees we're making sure the employees are getting all the PPE they need. And so I think that we've made the argument the whole time, green's got to go up, yellow's got to go down. Yellow, Trish, I'm going to get you real hard when that yellow curve, I can see it going down. But the yellow curve's flattened out, it's going down. And in the region, green's up, yellow's down. certainly the red curve, still new cases, but not in a trajectory that is overwhelmed our hospital capacity. And our hospital capacity, there's a lot of it, and that's why electives have been able to resume.
Wait, so you said, just to clarify, sorry, so we've technically flattened the curve, is that what you're saying?
Yellow
Or-
curve.
The yellow curve,
Yep.
okay.
Yep.
Work at the former Liverpool Country Club site seems to have paused. I'm wondering what the status is of that project and if it's Amazon.
Okay. Jeez. No comment on the second question. First question, I think there's a couple things working through. We got the exemption for it. Construction was going. You may remember that there was a special use variance related to fire. I believe that changed some of the design. Before you can really move forward with the rest of that, you got to get all of that right. You don't go start building a $400 million building before you know that's there. So my understanding is that's what the pause was. They've done a bunch of construction. Now they're waiting to have all that finalized before the rest of it gets going.
So it's not controversial. It sounds very technical.
Very technical at this point. I would think that if there was any other material changes, I would know, and certainly I would know. Right now, I don't know that anything is off schedule, really, other than that.
I ask you because you know.
Yeah, thank you, Andrew. Appreciate that.
Brian, you said you freed up $30 million in county money. What does freed up mean as opposed to?
Yeah, so essentially $12 million worth of salaries right now. We've taken austerity spending cuts to our budgetary lines that our departments usually need to operate, about 8% reductions there. We believe certainly we've done the retirement incentive as well. That will lead to certainly $2, $5, $6 million more. We took some cash capital and have not going to spend that cash capital on projects. We took some lines, kind of some of our initiative lines, and we've cut those back as well. So the number actually might even be more than 25 now, because we're going back to some of our partners that we contract out with for services and are asking for reductions in those contracts as well. We can't be in a position where we are getting hit and everybody else isn't getting hit as well.
So you've cut $30 million.
Yeah, so if there's a $30 million hole and that's it, we're good. If it goes, now there's $20 million of Medicaid FMAP funding that we're supposed to start flowing to the counties as well. That has not happened yet from the state. I don't know the status of that, but essentially if you added the $20 million, what that does is that cuts down our cost of the Medicaid. That means $45 million we've now covered. You get the feds to come in with some stimulus money. Maybe that number gets bigger, and our $75 to $150 million hole can get resolved that way if the economy comes back and our receipts don't get hit for 25 or 30%.
So if you were asked to give a number right now for a federal stimulus bill to go to Onondaga County, what number would you have?
I could tell you what our number was in the last proposal was $40 million we would have received. That didn't go through in COVID 3.5. $40 million is good. It's not what we need. It doesn't solve our problem, but certainly it makes things more manageable, and it gives you more tools to deal with the rest of the deficit. But part of the challenge in this, Tim, when you work with the federal system is the speaker in her state, cities have health departments. So there got to be something for cities. In Colorado, you have a swing state. You got a Republican and a Democratic senator there. Towns have health departments. So towns got to get something. In our county, towns have no expenses. They aren't losing revenue because we hold them harmless of property tax collection. They get no sales tax. So they've lost no revenue. They have no expenses related to this because they don't have health departments. They're not buying PPE. We're doing that. So in the last bill, you had towns getting money where potentially they'd get money, but they could only use it for lost revenue or expenses, but they would have neither. So that money to our towns of Onondaga County, they wouldn't be able to get. So we asked our leaders to say, if you're going to do this bill moving forward, and we think it is, that money should flow back to the counties if they have no lost revenue or expenses, and we only get it if we can show that we still have a gap. And so hopefully that type of language happens. But it's very complex at the federal level because across the country, different governments do different things.
The $12 million in salaries cut, where did those come from?
Unless your revenue dries up. And that's the one thing, I heard some comments from, and again, I give elected officials a lot of leeway these days because we're all under a lot of pressure. But, we had a balanced budget. I've been county executive now, 2 budget processes. Before that, I was the chairman of the legislature. But in 18 and 19, we delivered surpluses when I was county executive. And certainly we had every expectation in 2020 where we would deliver another surplus with a balanced budget. So it's not like we're in this hole because of fiscal mismanagement. We're in this hole because a pandemic came, and every government, including the biggest one and the second biggest one, agreed we need to shut down the economy, which shut down our revenues.
Part-timers work in what departments, just kind of across the board?
Yeah, 103 line it does a lot of work for part-time work for almost every department in county government. Any other questions? Okay, I want to give a big thank you to David Hubman, the district governor of 20/Y district of the Lions Club and the Lions Club International. Unsolicited, David and the District Lions Club applied for a grant from the International to feed our emergency first responders and medical personnel. So they were successful in getting a $7,500 grant and $7,500 worth of meals to our team of responders will now be taken care of because of David and the Lions Club. Again, another great story. This $7,500 is going to deal with meals, but it's all $7,500 is going to local restaurants to make these meals, put it back into the economy. So David, thank you very much for that, and thank you to all of our residents of the community that are helping make this process a little bit easier every day. Be safe.